So over the years, I found a lot of patients that suffer with mold illness, and they don't necessarily know that they suffer with that. So there's a complex of symptoms. So you can have everything from neurological complaints, hormonal issues, digestive problems, pains. So there's a lot of symptoms that you can have. Basically, the way it happens is you're exposed in some way, whether past or current, to mold. And usually that's going to happen in a building or a home from water damage, again. And you may not see it because it could be in the air conditioning. So when a person comes in and they present with a lot of different symptoms and they've not been really responsive to most of the treatments they've had before, it's always something that we need to consider, all right? There are tests that you can run to show whether or not a person has mold toxins that are impacting their body. Maybe they've been colonized by mold, so that would mean they have an infection that's due to mold and that's weakening their immune system. And of course, someone can have allergies. And you can have all three. So if we find somebody, again, that's not responsive to whatever traditional or holistic care that they've had, we check to see if there's a mold exposure in their history. We might want to check currently what's going on with respect to their environment. And then we'll start to run testing. And then once you run tests around it, you can provide some more insight as to what's happening, and then you start treatment. So the treatment for mold illness is going to be you have to get rid of the toxins. So there's different medical binders that we use, both prescription and non-prescription binders, to pull toxins out of the body. And then a lot of times what happens is the mold has caused a lot of inflammation. So you have to reset their system and reduce the inflammation. So that might be a step 2 to bring inflammation down. Dietary changes will go a long way also, because you have to strengthen the body. So there are certain foods that you're going to eat that are going to aggravate you and certain foods that are going to benefit. So when you've gotten mold illness, one of the things it can do is it actually causes you to have food allergies that you didn't have before. So one of the clues is, man, all of a sudden I'm sensitive to like dairy and I'm sensitive to gluten, and I wasn't before. I could always eat that. Now I find I definitely react to that. That could be a sign of a hidden environmental problem like a mold illness. So it's definitely treatable. You can definitely get better. I see people on the internet are sometimes panicked about it because depending on the situation, it could be really bad. But I think also people are getting a lot of misinformation that they think they have to turn everything in their life around, that they'll never be a full cure and they'll always be sick because of this. But personally, I did have that problem, and that's why I do this, because I had to figure it out and the doctors couldn't help. And so I know that you can be in a place where you're not having to think about that and worry about it all the time. And then you can start to feel better. You have more energy, brain works better, physically you feel stronger, you're able to do more and go back to life. Yeah, so when you live in a water damaged building or you've had some water damage in your home, again, usually through the air conditioning, but it could be behind a wall or wherever it is, there's different mold toxins that you might be exposed to, mostly coming from the molds Aspergillus and Penicillium. But there are others, and you can have trichosinines, which is like a black mold. That's the toxin from the black mold. You could have like a stachy mold, and that could have an impact, creating mold toxins. So there's a variety of molds and the toxins that are produced by those specific molds. What's most important is if there's a damp area or there's growth, we have to get rid of that, and then we have to detox that from the body. So simply put, mold can make you sick 3 ways. 1, the toxic element actually causes a toxicity in your body, generates inflammation. 2, it can colonize. So you breathe it in, it comes in through your skin, right? And as it goes into your body, it actually finds a place to live, usually somewhere dark and moist. So it'll go in the gut, the sinuses, the vaginal tract, urinary tract, and you can have yeast overgrowth in those areas. And then the 3rd way is the more common way that people know about, which is like, I have an allergy to mold. That's the most simple form. But oftentimes I find people have a combination of all those things. Yeah, so we've heard of black mold, which certainly can be toxic, but there's different types of molds and some of them are different colors. So it's not just black mold that we're after. However, if you're in a situation where there's a ton of mold that's visible or that you can smell it, you sort of know that it's there and it's bad, that I would consider that in some ways an emergency situation. You don't want to stay there. because something will ultimately happen to somebody in that home the more they take in. Every home, every building has a different level of sickness or toxicity. And every person in that building or home can react differently. Some will have more resilience, others will get sick. But you breathe that in long enough and someone's going to have a problem. If it's there, it's a problem, you want to correct it. I do think time is an issue. If you have a small problem that's been festering over a long period of time, that small problem could have generated a bigger problem for you. If you have a big problem, right, that's been going on for a short period of time, that can still have a large impact because the problem is so big, right? The mold toxins are so heavily or widely distributed. So it's all relative. Each case, again, has to be looked at individually. But it's not I have a lot of mold, so I must have a problem, or I have a little bit of mold, so I must not have a problem. It's an individual assessment. So when you have a mold toxin issue where the toxins have overwhelmed your body, they're usually working on the liver, the kidneys, and your brain is very susceptible to mold toxin as well. So it has a whole body impact, but you can start to see things like liver disease, you can see problems with the kidneys, and usually there's going to be brain-based symptoms like fatigue, loss of concentration, loss of memory, disorientation, and a person can have one or all of those things. And so when we say toxicity too, it doesn't mean that you would know that you're toxic necessarily. It's just that these impacts that the toxins are having on your body become the symptoms that you have. And so your body can handle a certain amount of toxin, right? You have a capability of doing that. Your liver knows how to detox these mold toxins. Your kidneys know how to do it. However, when your systems get overwhelmed, they might slow down their ability. And so you're just not getting the toxins out properly. And some people are more genetically susceptible also, where their body doesn't know how to tag these toxins properly. But my point is, we have an ability to detox. Everybody's exposed to mold, and most of us are okay. But when our bucket overflows and we can't do it anymore, that's when you see breakdown happen in the body. And so people can develop very severe illness as a result of this, where you have a diagnosable medical condition to your liver, to your kidneys, to your thyroid, to your brain, that's usually way further down the line. What we're usually dealing with are people that have symptoms and that are having loss of function in some of these organs, right? They're just not doing the job as well as they could because they're being overworked. And you start to support those areas with vitamins and different antioxidants, and you pull the toxins out, and the person can start to feel better. When we have a patient with mold toxin, we want to run some tests. So there's different tests that you can run in the blood that will kind of give you information about inflammation. So we might see some inflammation. And they're not the traditional markers that you would normally look at in a blood test. So most patients have not had these done unless they've seen a specialist for this reason. So we would run those type of blood tests that go through like a Quest lab. But then also we can look in the urine. So it's a simple test that you can do at home, whether it's a child or an adult. And you look to see how much mold toxin is actually spilling out into the urine. Now everybody's going to have some, because again, we're all exposed to some level. But what we're going to see is there's a normal limit and then there's above that normal. And so that's a really good way to start to get a picture of the severity of whether or not in fact this is part of the problem, if you're actually having a problem with mold, if you're maybe in an exposure and you're not sure that you're in an exposure. Those kind of testing can start to answer some questions. I don't like to put people in more fear, because a lot of people that are listening to this might already be fearful about mold or their illness. However, the reality is yes, mold toxins and mold illness can be life-threatening. Likely not tomorrow, right? So most of the people who are suffering are kind of suffering quietly in the neurologist's office, quietly in the rheumatologist's office, quietly at their internist or their GI specialist. And so they're not dying, right? However, there are people who are in situations, unfortunately, where maybe they didn't recognize the mold ever, and it's a really toxic environment. And yeah, you can see cancers and all kinds of problems that are life-threatening That's not going to be the majority of patients, because I hope by that time most of those people would have realized there was a problem. So with mold toxicity, some of the common diagnoses that we'll see, so we talked broadly about symptoms, right? You could have brain fog, you could have digestive problems, you could have muscle aches and pains, you could have neurological issues, you could have hormonal issues. So there's a lot that could happen symptom-wise, right? But then we get into diagnosable conditions. So patients who may have had a hidden mold exposure or a known one, but they didn't know it was a problem over years, may have been diagnosed with things like fibromyalgia, chronic fatigue syndrome, multiple sclerosis, rheumatoid arthritis, dementia, or early onset dementia. So there's a lot of different, but certainly gastrointestinal issues like irritable bowel syndrome or small intestinal bacterial overgrowth. These could be some of the diagnoses that people have had. Now I want to be clear, I'm not suggesting that if that were your problem and you were diagnosed with MS, that now you can cure your MS, or now you can, cure all your chronic fatigue syndrome, right? Because that has now happened, it has now occurred. However, what you can do is, if you get the appropriate testing and treatment for the mold illness, you can calm all that down, you can quiet down the symptoms, you may be able to put some of those things in remission, you certainly will improve your quality of life. And it also depends on how long you've been suffering with some of those conditions. So that doesn't mean that you don't have MS or you don't have chronic fatigue, but those diagnoses don't identify why you've gotten it in the first place. And the general consensus is we don't know why. But we know, based on research, that mold can stimulate your body to break down myelin sheaths, can stimulate your body to cause colonization in the gut, which would cause overgrowth of fungus, which would cause irritable bowel syndrome. So we know that it's a major contributor to these things. So we don't want to stay living in it, and we don't want to stay not correcting it inside of our own bodies.